Okay, so if you've been told that you need to have your wisdom teeth out, or you're wondering if you really do, you're not alone. And wisdom teeth removal is one of the most common surgeries done worldwide. But here's the truth. Not everyone needs their wisdom teeth out, and not everyone gets told the full story. So I'm a dentist, and today I'll walk you through when it's absolutely necessary to remove wisdom teeth, when it's safe to leave them alone, and what can happen if you make the wrong call. And you'll also learn how we as dentists really make these decisions, so you're not left on guessing or relying on myths. So let's dive in. But first, for a little context, wisdom teeth, or your third molars, start forming when you're around 7 to 10 years old. But they don't erupt until much later, typically between the ages of 17 and 25. And they were left over from a time when human jaws were larger, diets were rougher, and losing teeth was more common. But today, though, our diets are softer, our jaws are smaller as a result of evolutionary changes and modern nutrition, and most of us get to keep our teeth longer. So while our need for the extra chewing power has disappeared, our bodies still grow the same number of teeth. And for many people, that's where the real problem starts. So there's simply not enough room at the back of the mouth. And in fact, studies show that up to 85% of people have at least one impacted wisdom tooth. Now, before we go deeper, let's clear up a few myths before we start. So myth number one is everyone should get their wisdom teeth removed. And that's not true, because many people have wisdom teeth that are healthy, properly positioned, and cause no issues. And myth number two is if they don't hurt, they're fine. Again, not necessarily, because many wisdom teeth cause damage silently, and you won't feel anything until the problem is advanced. And myth number three is if you're over 30 and they haven't caused problems, they never will. Again, that's false, because issues can develop at any age, and gums, cysts, decay, even if the teeth seemed fine. And clearing up those things can help us make an informed decision, and not one that's just based on assumptions. Now the question is, do all wisdom teeth need to be removed? And the answer is no. Not all wisdom teeth need to be removed. And here's when we typically leave them alone. So if they're fully erupted through the gums, if they're aligned properly along with the rest of your teeth, if the gum tissue around them is healthy, if they aren't causing any problems or damage to neighboring teeth, and if they're easy to keep clean. In these cases, removal isn't just unnecessary, it could actually be more of a risk than a benefit. But, and this is important, wisdom teeth need to be closely monitored even if they're not removed. And that's because they can shift over time, gums can recede, and new problems can develop later over time. Now, when should wisdom teeth be removed? And here's when we get serious, because that's when we as dentists, based on years of research and clinical guidelines, recommend removal. And the most common reason is impaction. And that's when the tooth is trapped under the gum or the bone, and it can be mesioangular, so it's angled towards the front. It could be vertical, so it's upright but it's stuck. It could be distoangular, it's angled backwards, or it could be horizontal, so it's lying sideways, and that's usually the one that's the most problematic. And the impact here is it can cause pressure on adjacent teeth, it can cause gum infections, bone damage, and it can also cause an increased risk of decay. And the second reason is partial eruption. And this is when the tooth breaks through the gum, but not completely. And what it does is it creates a flap of gum tissue called operculum that can trap food and bacteria, and that can lead to something known as pericornitis, which is a painful gum infection. And the common symptoms here are swelling, bad taste, and difficulty opening your mouth, trismus. And moving on to the third reason, that can be cysts and tumors. So these are fluid-filled sacs called dentigerous cysts that can form around an impacted wisdom tooth. And rarely, sometimes we can also have tumors known as ameloblastomas. They can develop as well. And these lesions can destroy the jawbone, and they require complex surgery. And most cysts are usually painless until they've caused significant damage. And that's why routine x-rays are important, and that's how we try and catch them early. And the fourth reason is damage to adjacent wisdom teeth. And this could be pressure from a misaligned wisdom tooth that can resorb the root of a neighboring second molar. And the result here is potentially the need of a root canal, or it could even be the loss of a perfectly healthy tooth. And the fifth reason is crowding and orthodontic issues. So this is for patients who've had braces. Sometimes we worry about wisdom teeth pushing the other teeth out of alignment. And the studies regarding this are still mixed, but what we know is crowding can happen, especially if there's no space. And the sixth reason is decay and gum disease. So wisdom teeth are harder to reach, and that can cause a difficulty in brushing and improper flossing, or sometimes even it's impossible to floss around there. And what it does is it creates the perfect condition for decay. And gum pockets can also develop around there, leading to something known as periodontitis, which is a serious gum infection that can destroy the bone. And the bottom line here is if the wisdom teeth are impacted, infected, decayed, or posing a threat to neighboring teeth, then they usually need to come out. But, and this is important, wisdom teeth aren't automatically removed just because they exist. In fact, a wisdom tooth could be partially erupted but not causing any symptoms. It could have no history of pericoronitis. It could show no signs of decay or damage to adjacent teeth. It could have no cysts or tumors, and the surrounding gum tissue could be healthy. In such cases, many of us dentists recommend leaving the tooth in place and simply monitoring it over time with regular checkups. And the idea here is simple. If the tooth isn't causing a problem or there's no evidence that it will, then there's no need to remove it just in case. But regular monitoring here is key, because if anything changes like infection, decay, gum problems, cyst formation, or crowding, then the decision needs to be reassessed. And it's always case-by-case basis based on your specific situation and not a blanket rule. Now let's talk about risk, because the choice of wait and see can come with consequences. And the possible risks of leaving a problem wisdom tooth can be silent damage, so you might not feel anything until a neighboring wisdom tooth is lost or damaged. You could have an infection, so gum infections can spread pretty quickly. You could have a cyst formation, so these are slow bone-destroying cysts that can grow undetected for years. You could have sinus problems, especially that's more related with the upper wisdom teeth, that can sit close to the sinuses, and that can lead to congestion, pressure, and possibly even sinus infections. And also you could have a complicated surgery later on. So as we age, basically our bones get denser and the risks of complications increase. So removing a wisdom tooth at 35 is very different from removing a wisdom tooth when you're 19. And silent here doesn't mean safe. So wisdom teeth can smolder for years before showing any symptoms, and by then the damage could be far more extensive. It could be harder and more expensive to fix. Now, if removal is the best decision, here's what you can expect. So regarding the procedure itself, for most wisdom teeth removals, and even many impacted ones, local anesthesia is usually enough. And this usually means that the area is completely numb, but you're awake and aware. But for patients who feel nervous, or if the extraction is expected to be more complex, there are additional options. So it could be IV sedation. That's when you're in a deeply relaxed state, but you're still breathing on your own. And you could have also general anesthesia, but that's usually reserved for very complex cases, or if you're having multiple extractions done at once. And procedure times vary case by case, but on average, removing a wisdom tooth takes about 30 to 60 minutes. And as a recovery timeline, you can have swelling that peaks at 2 to 3 days. Most patients return to normal activity within 7 days, and I suggest soft diet for the first few days, and pain management medications, so over-the-counter options like ibuprofen, paracetamol, or maybe some doctor-prescribed options. And us as dentists, we don't just look at whether you have wisdom teeth. We look at space, so is there enough jaw room? We look at the position, so are they straight or angled? We look at the condition of the wisdom tooth, so is it healthy? Is it decaying? We look at the impact, so are they harming other teeth or bone? And we also look at risks, so are they close to important nerves or sinuses? And we use x-rays to assess that, and sometimes we might use 3D imaging, so CBCT scans, to assess all this before giving advice. And it's all about balancing risk versus benefit specifically for you. And to summarize it, basically, if they're healthy, fully erupted, easy to clean, and not harming anything around them, you can keep them. But if they're impacted, infected, causing damage, hard to clean, it's safer to remove them earlier rather than later. And the key here is to get them evaluated early before problems develop.